The skin of babies and toddlers are super fragile, and usually when they have skin problems, it's because their bodies are trying to tell you something. So as a parent, here are 3 of such problems that you should look out for and what you can do to help. The first very popular skin problem a lot of children have is eczema. Eczema is one of the more frequent skin conditions, and it causes these patches of red, dry, and very itchy skin. You might notice these patches on the face, behind the knees, on the arms. You may notice it all over the body depending on how pervasive it is. And even though the exact cause of eczema is not really fully understood, but there's a lot of genetic and environmental factors that often play a role. And what eczema signals is that your child's skin may be too dry or too sensitive to the environment that they're in. This condition often points to an underlying problem that could be linked to allergies or other genetic factors as well. In other words, is the skin's way of saying, I need extra moisture and a little bit more gentle care. So managing eczema involves keeping the skin very well moisturized, avoiding any sort of harsh soaps, and using gentle, fragrance-free products. And if your child experiences severe flare-ups, it's important to consult a pediatric dermatologist who may recommend more medicated creams and other treatments. The next skin condition is the diaper rash. This is a very common problem, especially among infants, and is typically caused by prolonged exposure to moisture and friction from the diaper. It could even sometimes be a yeast infection. Diaper rashes usually appear as these red, irritated patches of skin around the diaper area. And what it signals is that this area has been exposed to moisture and friction for diapers for too long. And this moisture is irritating your baby's delicate skin. It's indicating that your baby's skin needs a break from the constant dampness. With diaper rash, prevention is key. There's really nothing you can do to stop a diaper rash other than making sure that you change the diapers frequently and let the baby's skin breathe as much as possible. Also, you want to use any sort of barrier creams like petroleum jelly or other barrier protecting creams that would act as a moisture barrier from things like pee and poop. And if the rash doesn't improve after a few days or if it seems to worsen, then you need to contact your pediatrician. And the third condition is impetigo. Impetigo is a highly contagious and bacterial infection that often affects children, usually those that are in daycare or kindergarten. And usually it will start as a red sore, and then it will quickly develop into these fluid-filled blisters that will burst when touched, and they can form this yellowish brown crust. Impetigo signals a bacterial infection, and it shows that bacteria has found its way through the skin's defenses and is now causing an infection. This is a medical emergency and it requires immediate medical treatment to stop it from spreading. And while impetigo is kind of common amongst children that are in daycare or kindergarten, it really does require a lot of medical follow-up because your pediatrician will have to prescribe very strong topical antibiotics to make sure that your child doesn't go on to infect other children. So maintaining good hygiene and keeping that area clean is essential to preventing the spread of that infection, as well as keeping your child away from other children who may not already have had this disease. Stay healthy.